Hello everyone, I am S. Pragadeswaran, course instructor of hospital management. Today here we are going to see the challenges in hospital administration. So it is not going to be like a regular lecture. Today we are going to incorporate the one of the best teaching practice method called pedagogy. So in this pedagogy, today we are making students to actively take part and learn the challenges in hospital administration in an efficient manner. So before getting into the activity, now I would like to say or suggest few of the key points that are related to this hospital administration. First, I would like to give an overview of hospital administration. The hospital is an organization that mobilizes the skills and effort of wide divergent group of professionals. So that includes semi-professionals and non-professional persons also. Why? Because to provide highly personalized services to individual patients. Like other organizations, hospital is also established and designed to pursue certain objectives through collaborative activities. And the main objective of this hospital administration is to provide adequate care and treatment to its patients. Its primary product is medical, surgical and nursing service to the patients, and its central concern is the lives and health of the patient. A hospital may of course have many additional objectives that ranges from its own maintenance, survival, organizational stability, growth, improvement in financial status, medical, nursing education, and research and various employee related objectives. Then coming to the importance of hospital administration. Hospital administration is a science and art of application of the principles of public administration. It deals with many matters like promotion of health, preventive services, medical care, as well as the development of medical education and training. Research studies of administrative practices in India has felt that health administration is a crucial area for research since health administration is lagging research based literatures. We have many literature surveys based on medical treatments, based on the symptoms, based on the patient's experience, but there is a lagging in literatures that are related to the maintenance, that is the management or hospital administration. Still, adequate research has to be undertaken in this regard, mainly on the administrative and human resource practices of hospitals. Then coming to the view, what makes a hospital successful? The success of a hospital is generally measured in terms of patient care, efficiency, experience of personnel and community service. So absence of any one of these requirements leads to the failure so that the entire system may get collapsed. The administration is mainly responsible for the success and smooth operation of the hospital. The administration should be available, easily approachable, and be ever willing to meet and listen to the staffs and the patients, and should be ready to do anything that is for the good of the hospital. Today we are going to perform the pedagogy activity role play. So now I would like to call the students to perform the role play as a team.
A very pleasant day to all are gathered here. I am Varnika from 4th year Electronics and Communication Engineering Department of Karpagam Institute of Technology, and today we are here to perform a role play on challenge Administration under the course of Hospital Management, and here are our team members.
Hi everyone, this is Sandeep Priya.
Hi everyone, I am Monica.
Hi everyone, I am Pragadeswaran.
Hi, I am Pradeep.
Hi, I am Subhash.
Please wait in. May I know what's bothering you?
I am suffering from lot of anxiety for the last 4 days.
Please show your hand. Doctor, emergency. Just a minute, can you please sit? Excuse me, ma'am. I know what's bothering you, ma'am. From your pulse. Doctor, emergency. Please give me a glass of water. So are you okay now?
Doctor, what's happening here? There are a number of patients waiting and suffering from sort of diseases.
I'm so sorry, sir. Due to this pandemic issue, many doctors are not available right now. And resources are also very less. That's why we are also facing a lot of problems. We are so sorry for this.
But lot of patients suffering
We are so sorry for this, sir. We will rectify it soon.
because
So during this pandemic issue, there exist many problems across India and also all over the world, where all the hospital administrations has faced a lot of shortage in person, like which includes even the medical resources as well as the human resource, which includes the staffing and hospital management system. Scene 2. We welcome you all to KIT Hospital. Here we are about to enact about the different challenges which are faced in hospital administration. First and foremost, it's personnel shortage. Scene 1. Hope you're doing well. You're supposed to take few more scans and reports. It will take around 3 hours. Can you please wait for another 3 hours?
So
Yeah.
what? From the morning we are waiting here for you and we are taking all the reports.
No, sir. Few more tests are recommended, sir. Then only we can clarify it.
So then you can tell it in one so we can.
No, sir. One by one only I can proceed, sir. I can't say to take everything in at a go, sir.
You can tell the starting when all the things are there.
I'm so sorry, sir. This is the hospital procedure, sir. I can't do anything for that. Only by one only can take reports, sir. Few tests should be taken in the morning. Some should be taken in the afternoon. That's why these are the procedures. Then only we can evaluate what disease or what kind of problem you have, sir.
Even we are from the morning we are taking a lot of reports and it will be a long time.
Not only you, sir. Many patients here are like that only, sir.
Every 10 hours we are waiting in the hospital and taking it.
So when you're coming for hospital, you can't see times. It's not something like a movie or thing you can complain times, right? Please understand, sir. I will suggest you few more tests, sir. Please you take and come so that I meet you by tomorrow, sir.
Tomorrow when you can come tomorrow.
Yeah, sir. You're supposed to come tomorrow also. You are from here only, right, sir? Or
We are
from
from maybe 10 kilometers. 10 hours we are traveling.
Sir, no other goes. Either you stay here or you can accommodate in hospital itself. So you can get your run to be done here. You just see what possible you can do.
what's up?
So sorry, sir. Sir, no. This is the hospital procedure. Please. So patient satisfaction. Patients are not satisfied from their point of view, but then from hospital administration, we have no other choice. As doctors and from hospital managers, we have only rules and regulations to be followed, and with few time intervals, we are supposed to be following them. So we are so sorry for that, but still you are supposed to follow that. Thank you. Scene 3. Financial constraints. In KIT Hospital, we have a patient who is very serious, and the scene is about a serious patient. We tried a level test. in family as well as the hospital management. The family cannot afford no more because his or her son is no more. But the management can't take its responsibility. So here both the hospital as well as the parents face financial constraint. This becomes a major issue in many hospitals in current days, and there exist many cases and case study regarding these. And we all have been aware about the recent thing in which they didn't give his son because they didn't pay the final payment. Scene 4. Communication and collaboration. Many rural people are unable to understand the native languages of doctors. So here we depict an incident in which the parent doesn't understand the doctor's language. The patient named Maumita is suffering from some serious illness and stroke. Can you go examine her? थोड़ी देर wait करो. हाँ. क्या हो? Please examine. Are you okay? Please call the parents. उसके parents को बुलाइए. हाँ जी. तुम्हें बेटे के लिए पेट में कुछ प्रॉब्लम है, इसलिए उसको ठीक करने के लिए कोई ऑपरेशन करना की जरूरत है. इतना छोटा है. Today we have enacted the challenges faced in hospital administration from both the point of view from the people as well as from the hospital management. Thank each and everyone for this wonderful opportunity, and most and foremost we thank our course instructor for giving us this wonderful opportunity to enact such a thing and making our class very much interesting. Thank you, sir.
Hi, I'm Audition from 4th year ECE department. Today we had a pedagogical activity on the topic challenges in hospital administration. This pedagogical activity was very interesting than the normal chalk and board lecture. We enjoyed the activity and we gained much more knowledge in this. Thank you.
Hi, I'm Kavya from final year EC department. This pedagogic activity helps us to reach many things, and it helps us to understand the real-time things, and it's an easy way to understand even the tough subjects and tough topics. And they handle that in a very funny way, and as well as it reaches in a very strong manner. So it will be very helpful for us, and this activity really helped us to understand a lot of stuff apart from the academics. Thank you.
Hi everyone, I am Sandeepriya. I am from final year GCEP. In this pedagogical activity, I learned lot of things, especially communication and coordination. So thank you so much for giving this opportunity.
Hi everyone, I am Garunika from 4th year EC department. Today we have performed a pedagogical activity and enacted role play. In this we developed a main point called team spirit. We worked as a team. We started researching for this topic which actually created a lot of creativity skill in us.
Over the last few centuries, hospital administration has witnessed drastic changes. I have like to list few of the changes. So nowadays, the hospitals becomes a very large as well as a complex organizations. Technology has developed in an exponential manner. It became advanced day by day, as well as the healthcare financing has moved from private pay to the complex as well as the third parties. So nowadays, government has taken on a larger role in the healthcare delivery. Despite these significant changes, the field continues to focus on the business and financial aspects of hospitals, clinics, and other health services, with particular focus placed on efficiency and financial stability. The primary role of today's professionals in healthcare administration includes human resource management, financial management, cost accounting, data collection and analysis, strategic planning, marketing, financial functions of the organization, providing the most basic social services, the health care of dependent people at the most vulnerable points in their lives. It also includes the maintaining the moral and social order of healthcare organization as well as serving to patients, advocates, serving as arbitraries in situations where they are completing values. then serving as an intermediate for various professional groups practicing within the organization. Now, I list some of the challenges in the professionals in healthcare administration that we are facing in today's lives. So, first and primary thing is to ensure the effectiveness as well as efficient healthcare services for all communities. Then the second one is the shortage of manpower, that is nurses and other healthcare workers. Concern for the safety and quality of healthcare services, rising healthcare costs and aging populations, rapidly changing medical technologies and practice. These are all the main challenges that the hospital administration is facing in this modern world. So these are the key points that we had extracted from the role play